is, as the cause of a patient's abnormal dominance is the helper-suppressor ratio in the T cell. It's also called CD4 and CD8. So what happens? We run this blood test, we're checking the T cells, and if your CD4, CD8 ratio, the helper-suppressor T cell ratio, is 2.5 or higher, you have an active antigen problem. If it's 1.2 or less, you have a dysregulation problem. It's a problem with blood sugar levels, anemia, something along those lines, adrenals. We want to look at intestinal permeability. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasite, or infections. We want to look at your hormone panels. Hormones can play a part in this, but here's the deal, folks. If you're autoimmune, that trumps everything. If you have an autoimmune thyroid, we need to address that first. Then we treat you neurologically. Brain and thyroid have this connection. Remember I mentioned about the pituitary gland. Also the hypothalamus comes into play. So we want to increase frequency of firing of brain. There's something called the HPA axis, hypothalamus, pituitary, adrenal axis. And by increasing frequency of firing of brain, we can help heal you faster. So we use oxygen therapy, specifically exercise with oxygen therapy, to improve thyroid function. We get you on an upper body ergometer, it's like a bicycle for your arms, or an elliptical machine with oxygen. We may use auditory stim, listening to sound in one ear, fires up the opposite brain. Or we may use visual stim, or we may use an interactive metronome. Interactive metronome is auditory, visual, and motor stim. You're listening to, have a headset on, you're listening to a sound of a call bell, you're clapping to it. But it's measured in milliseconds, it's all computerized. We may use vibration therapy. Stimulates the back part of the spinal cord up to the cerebellum and then to brain. So all of these neurological components. So how do we get your thyroid under control? How do we help you heal? How do we help you feel better? By treating you metabolically and neurologically. Specific neurological and metabolic testing and treatment. So ask yourself the following questions. These are serious questions. How has your thyroid condition affected your relationship, finances, family, or other activities? What has it cost you in time, money, happiness, sleep? Where do you picture yourself in the next 1 to 5 years if this problem isn't corrected? What is it worth to you to improve your condition? And the reason I ask you this is I only want serious patients in my office. If you have an autoimmune thyroid and you're sensitive to gluten, and you will not stop eating gluten like I've had a few patients, don't waste your money and don't waste my time. I'm not trying to be rude. I'm not trying to be mean. I'm just telling you I take this extremely seriously. So, I only accept those cases that I truly feel I can help. I'm here to offer you 2 free visits. You come in, we look at your thyroid, we look at your information, we run some tests, and then what I'll do is dismiss you. We'll set up a second visit. In between the first and second visit, I will examine and look at your case. And on the second visit, I will let you know if I accept your case for care in my clinic. So if you'd like that, call our office, 920-739-6971. That's 2 free visits, 920-739-6971. This is Dr. Johnson saying thank you for taking the time to watch this video, and I look forward to hearing from you in the future.